We all have one talent that we've been perfecting since the moment we were born. We have grown so accustomed to it that we can do it without thinking. We can even do it in our sleep. And if it was an Olympic sport, we would all probably be tied for first place. Now, what is this mystery talent that we all seem to share? It's breathing. And now I know what you might be thinking. Breathing is not a talent. And you're right, it's not. It's actually a privilege. About 65 million people suffer from chronic obstructive pulmonary disease, and about 3 million die from it each year. Chronic obstructive pulmonary disease, commonly referred to as COPD, is a group of progressive lung diseases, the most common being emphysema and chronic bronchitis, and they usually occur simultaneously. Emphysema slowly destroys the air sacs in your lungs, which interferes with the outward airflow, and bronchitis causes inflammation of your bronchial tubes, which strains your breathing. So patients with COPD suffer from chronic shortness of breath, wheezing, and chest tightness. And as you can imagine, struggling to breathe significantly decreases your quality of life. And it makes it especially hard for patients to participate in any type of physical activity. Currently, there's no cure, only treatments that can slow the progression of the condition. And for a patient with this disease, it's a game of trial and error to find the right medication or therapy that works best for them. However, there are many clinical trials happening right at this moment to find the best solution to this growing problem. Now, clinical trials may seem like a holy grail, but some potential risks that clinical trials may face include unknown side effects that actually might be worse than standard treatments. The new treatment works on some, but not on all patients. And even in extreme cases, it can result in patient death. So, what's an alternative to having patient-based clinical trials? This is where 3D organoids come into the picture. Organoids are complex clusters of organ-specific cells, such as those that come from your liver, your bladder, or in this case, your lungs. They're made of stem cells and they self-assemble when given an extracellular environment, such as collagen or most commonly used matrigel. And when that happens, they grow into microscopic versions of their parent organ, and they're viable for 3D study. Organoids allow for the expansion of stem cell populations from a very limited amount of starting material, and they provide a more physiologically relevant culture system. Specifically, lung organoids allow researchers to study the processes that control the regulation of lung tissue, and it makes it possible to manipulate their microenvironment and helps determine how it contributes to its regeneration. But most importantly, scientists are able to model real human diseases in these organoids, and it helps them better understand the disease pathology and its translational application into efficient treatment for patients. Patient-derived organoid cultures from biopsies or surgical resections present a great improvement to disease modeling, meaning that scientists will be able to test therapies and drugs directly onto patient-derived organoids. This is reducing the risk that patient-based clinical trials present, since they're testing the tissue externally in a lab. So it's great that we can produce these organs, but what research is currently taking advantage of their properties? Well, in May 2019, scientists at Cincinnati's Children's Hospital were able to successfully bioengineer a human liver organoid that mimics key features of a liver disease. This allowed them to uncover the underlying disease biology and test a potential therapy directly onto it. On February 5th, the American Lung Association awarded $50,000 to the USC stem cell scientist who's generating lung organoids to probe how a specific population of cells repairs the alveoli in damaged lungs. And his goal is to harness the regenerating factors of these cells to promote healing through a non-surgical approach. So as a quick recap, by using lung organoids, we can investigate the function of lung stem cells in distinct regions of lung tissue, while also observing their behavior in different microenvironments. The generation of patient-derived organoids provide a powerful resource for a wide range of translational medical approaches, such as efficacy studies and disease modeling and treatment. Therefore, 3D organoids are a key factor to making clinical trials substantially more safe, efficient, and effective, helping everyone reach the Olympic level breathing we all deserve to have.